My name is Dr. Paul Laboi. I'm one of the kidney consultants from York Hospital. I look after people with severe kidney failure and often prescribe chronic hemodialysis treatment. This treatment is a fairly restrictive and time-consuming treatment which lasts for 4 hours, 3 times a week. The traditional model is that patients would come into the hospital for this treatment on a rigid schedule. Here in Harrogate, we have a brand new unit, a self-care unit, where patients have a flexible schedule which they can flex around their daily lives rather than on the dialysis schedule in the hospital.
My name is Andrew Cundiff. I'm a charge nurse at Harrogate Renal unit. The way it works in the self-care unit is that once the patient is fully trained, they've got a card that opens the door, they're able to come in, set up the machine, get on dialysis, get off dialysis and then get on with their life.
My name's Michael Paul. I've had kidney failure now for a number of years. I've been coming to the new self-care unit for the past month now. I do work, I'm in a full-time job, and having this facility here allows me to do my treatment around my work, whereas before, in the traditional way of doing dialysis, I had to be quite rigid with the times.
So Michael's just attending to an alarm, and the canister that provides the dialysis fluid just needs changing over. So sometimes an alarm will go off and he has to troubleshoot and determine if any parameters on the machine need to be altered to continue dialysis.
It was very easy to learn how to actually manipulate the machine and how to work it properly. But should I run into any problems, I know that I can contact any one of the nurses or Andrew, who's at the other end of the phone.
For patients like Michael, who've become more confident, this empowers them to take more ownership over their disease and provide more dialysis for themselves, which benefits their health greatly.
It's very uplifting for me because now I have complete control over what I'm doing and I'm responsible for my particular treatment. I feel healthier overall. That noise tells me the time to come off the dialysis machine. So here goes. That's it, done. And that's the end of dialysis for another day.
So we've seen Michael do his own treatment completely independently, safely, and concluded his treatment to the same standard that you would have had in the hospital dialysis unit. And this just proves the point that patients can be trusted to take care of themselves in a complicated setting such as dialysis. And this is breaking away from the mold of a traditional patriarchal method of doctors and nurses doing everything for the patients and the patients being a passive partner. Now the patient is an active partner, takes part in decision making and is able to do dialysis themselves. We know from home dialysis patients that home dialysis is safe, it's an effective and efficient treatment, and it prolongs survival and gives them a better quality of life. One of the most satisfying things about self-care is there's been a massive cultural change in the way that staff members view patients. There's a lot more healthy respect for our patients. We treat our patients as individuals. We acknowledge a little bit more as to what goes on in their lives. We appreciate their experiences, and we would like to do more for our patients.